Hello, everyone. Good morning, good afternoon, good evening, friends, members of the TMA family. Hello, hello, hello. Everybody's connecting and coming in. I see some audio connecting, a few friendly faces on video. Hi, nice to see you or meet you. We have a great program coming up in our meet and greet series. So welcome. Welcome to my birthday month. I was born in February and
It's
in
my
1 week
birthday month
time.
too, Paula.
That's true. I guess welcome to our birthday month from Rachel and myself. And I think everyone's come in from the waiting room, all of our on-time arrivals and early birds. So Laurie, we can get started. I'll let you advance and give the official welcome.
Sounds great. Well, welcome everyone. My name is Laurie Boyer. I'm the chair of the TMA Board of Directors, and I'm extremely excited to see you on here today and connect during our meet and greet series. We have the wonderful Paula Eichenbrenner, our executive director here at the Myositis Association, as well as Debbie Armstrong, who's a former representative for New Mexico Legislature. Sorry, that's the New Yorker me coming out. It's the other new. So if you don't mind taking a moment and dropping in the chat, which city and state are you connecting with us during the meet and greet? Honestly, that's almost one of my favorite parts usually to this, to kind of see where's everyone connecting from throughout the US and the world.
Looks like we've got a great cross section of folks. Hey to Shalise in Bowie, Maryland. TMA's office is in Columbia, Maryland, so I'm often there. Today I'm on the other side of the river. Hi, Martha in New Hampshire, layering up, I'm sure. Wow.
Oh, I see some friends from Wisconsin and Salt Lake City, Utah. How fun.
Great to see you all. Thank you so much for joining us.
And if anybody else has a February birthday, let us know in the comments in the chat section too.
You know, Rachel, I think one of these days we should have a TMA virtual program where we organize breakout rooms by birthday month. That's a truly random and fun way to meet other people, I think. I've always been a little extra about my birthday because, you know, Rachel and I having February birthdays, it's the shortest month of the year. So I feel like that's how we can kind of give back and make February sort of an even contributor to the calendar year if we're really, really extra about our birthdays. Oh, Denny! Hey, fellow Aquarius, February 10th. I'm the 13th. Rachel, you're the 18th, right?
Yeah.
Fabulous.
I also wanted to point out Shalise Williams is on from Bowie, Maryland, and I got an email from her that she will be coming to visit with us at NIH Rare Disease Day. So I am very excited about that.
Thank you.
Yes.
Thank you.
Yes. Look forward to hanging out with you there. Oh my
Absolutely.
gosh. And happy birthday to Madge's sweet husband, Ray, and may he have an amazing heavenly birthday today.
Absolutely.
I have a friend also who has a birthday today. Yay.
Joe, is it your birthday today?
No, it's actually a good friend of mine, though. Her name is Sarah, and she's got a birthday today. Yay.
February 6th is a good day indeed.
Mm-hmm.
I like Angie's suggestion there for do we bring any Valentine chocolate to this meet and greet? That's a good one.
I can neither
make it
confirm
extra sweet
nor deny how much chocolate might be in my house.
There's not much in her office because I'm always coming in there and eating it. And her door was closed for a meeting the other day. And I was like, I wonder if I could still go in there and just get the chocolate because I was needing it.
Understandably.
Well, just a couple of reminders for today. We are recording and this will post to YouTube. This is not a webinar. This is a conversation, right? In a series that Laurie and I started last year where we bring in special guests and get to know members of the myositis community a little bit better. So you can submit any questions you have in the chat box of the Zoom application, or you can just raise your hand or use the reaction button. That's how you do that, or just unmute. You know, this is designed to be interactive and casual.
So just a reminder for the Myositis Association, our mission is to improve the lives of persons affected by myositis, fund innovative research, and increase myositis awareness and advocacy. Because ultimately our vision is a world without myositis. And I can promise you the TMA staff team is working hard on our mission-driven work, and so is the board to support them. So we're really excited of what's to come in 2025. So let's do a little getting to know you. What is the top emoji that you're using when texting on your phone? So the ones that are popping up in that recent tab, which one is one that's kind of your go-to that you tend to use a lot when texting? Feel free to drop that in the chat just for some fun.
Ooh, I like Myositis. I like Sparkle Heart. I have a t-shirt that says glitter is my favorite color. So sparkly heart emoji or the sparkle emoji, the magic wand emoji, and the starry-eyed emoji are all favorites. But Laurie said I had to pick just one.
Not bad.
That's a good one, Rich. I'll put my starry-eyed emoji on top of your whiskey glass emoji.
Martha, I connect with that one. I feel like, yep, that's me giving the wink of understanding, right? This is great. Well, keep them coming. It helps us to feel you guys out and feel the personalities coming through. So thanks so much for sharing. All right, and then everyone loves a good GIF or GIF, whichever way you want to say it. So which one describes your work week? Do you have one that's a go-to? That one's me. I'm always excited when it's almost Friday. I call it Friday instead of Friday. So that's me getting fired up.
I've also heard Laurie call Thursday Friday Junior or Mini Friday, like M-I-N-I.
Yeah.
So yeah. Have y'all seen the GIF where the cat is typing furiously like this?
Yeah, the furious typing cat, yes.
That's my week sometimes, especially a week like this. We've been launching new web pages ahead of Myositis Awareness Month and some of our other awareness campaigns that are very supportive of our advocacy efforts, of course. So lots of typing, writing, refining, editing.
Who said what's a work week? Yeah.
Love it, Martha.
I mean, we may still have more work for you yet.
And then I thought this one's totally appropriate because I'm down here in Florida, which is like the spring training capital of the world. It seems like we have the Mets here in Port St. Lucie, even though secretly I'm a Yankees fan. And so during Myositis Awareness Month, we have a great guy, Vance Robinson, who works hard to raise awareness through what he calls the First Pitch campaign. So if you were a baseball player, what would your walk-up song be? So think about it. What song personifies you? What brings your personality to life? Ooh.
I think mine would be One Fine Day by the Chiffons, which I know is a throwback, but I just love that beat. One fine day. I won't sing the rest of it.
No, you are not. Sorry.
Feel free to type that one, Paula. No, you get an A for effort. I'll take you as my karaoke buddy. No worries. Oh, these are great.
Karaoke, that could be a fun
Unstoppable.
activity at a TMA patient conference one year. I don't know if we've ever done that. We have been convening TMA's International Annual Patient Conference for 30 years, since 1995.
30 years.
And I know we've done bingo and dances and all kinds of fun activities, but I don't know if we've done a karaoke.
Wow, I'm loving these titles too.
But it wasn't karaoke. And I think that's a great idea.
I like it. It just brings out good spirits and good feeling, right?
Yep.
Well, I'm going to turn the mic over to our Vice Chair, Rich DeAugustinis. He is going to give us an update on Proclamation 50.
Thank you so much, Laurie.
Sure.
Hope everybody's doing great today. I have the the honor and pleasure of leading this effort for TMA, for our board, and for our community. Simply put, what we're trying to do is shout from the rooftops about Myositis Awareness Month. Obviously, this is a something we do every year. And ultimately, at its root, it's about driving awareness of myositis, awareness of the journey that many of you or most of you are on, and driving awareness with the right stakeholders and constituencies that can help us achieve our mission. We've gotten proclamations in the past, and we decided to set a goal this year to get one from all 50 states. And extra credit would be to get a bunch more from cities and counties across the 50 states. But we have a plan that we're working to get one from each of the 50 states and from the U.S. Congress. What you see on the screen here are the 9 states listed in bullets there where we don't have a state coordinator yet. We're looking for a volunteer from each of these states. If you are in one of those states, I'd love to talk to you. If you have anyone in your network, family, friends, what have you, that lives in one of those states that you think would be willing to give us a few hours, and I don't think it'll take more than a few hours over the next few months to pursue this for us, I'd love it if you could put me in touch with that person. Once we get all 50, we're in great shape. So I've held a couple of Zooms already, information sessions to kind of walk people through why we're doing this, what we're doing, how they, what their plan should be over the next couple of months to pursue these proclamations locally. They've gone really well. The most recent one was yesterday. We had great turnout for that. I've got 2 more planned later on this month. And in fact, I recognize a number of the names that are connected today. A few of you were on the session yesterday. Great to see you again. So you're obviously very familiar with what I'm talking about here. But if any of you are hearing about this for the first time and you're interested in helping, I encourage you to check the links in the chat and follow through and sign up to get more information there. Appreciate your help in advance. And feel free to ask any questions about this. I'll be answering those in the chat as well. Thanks for the opportunity to share.
Thank you, Rich.
Thank you, Rich.
And thank you to all of our, let me see if I can do this math, 41 state coordinators who have signed on to the states that have been covered already. And maybe we can close the gap this week and get 1 or 2 more of these final 9. Laurie, I don't know if we should do a little bit of a drum roll, but in the next section of our meet and greet, we get to introduce today's special guest. This is even better than daytime TV, right? I mean,
Yes, I definitely think it's drum roll worthy. Say that 3 times fast. Go ahead, Paula, you want to introduce Debbie to us?
Sure. I'm so excited about it. Please let me introduce Debbie. Thank you. We are really so happy to have Debbie Armstrong with us today. Debbie is a TMA member, and she served 4 terms as a state representative in the New Mexico Legislature, stepping away from that role in 2022. She has such an incredible record of legislative advocacy and nonprofit management and healthcare leadership to share with us today. So we're really excited to hear from her and from each of you on the line about how we can level up in TMA's mission area of awareness and advocacy. You see on the slide here some of her accomplishments. She currently serves as board chair of a nonprofit called the End of Life Options New Mexico, and she has a background in physical therapy and is an attorney. So I just think she has the perfect background to be an advocate for the myositis community, and she has been living with necrotizing myopathy since August of last year. Correct, Debbie? 2024 was your diagnosis. So
yes,
welcome, Debbie,
right.
to Meet and Greet.
Thank you. Thank you. I'm really excited to be here. Are we gonna stop sharing the screen so I can see everybody?
Yes, we are.
Okay.
please do share a little bit more about yourself and
Yeah.
you know what led you in the career pathways that you've pursued.
Thanks. Yeah, it's a 50-year career, but starting out in physical therapy and did that for a long time in every care setting, and then decided to go to law school. I was interested in health policy, and I did that and went graduated law school more than 20 years ago, and never actually practiced as a lawyer, like in a law firm representing clients, but was focused on health policy, and was secretary of the Department of Aging in New Mexico for a number of years. And after that, I formed my business that manages nonprofits. And my particular client that I have worked with for the last 16 years as the executive director is the New Mexico Medical Insurance Pool, which is a high-risk insurance pool serving folks with way before ACA. It was created in the state legislature to provide insurance for people who had pre-existing conditions. And we still find gaps where people can't get insured. And so we still have several thousand people that we insure in that program. And legislator, 8 years. I was the chair of the Health and Human Services Committee for almost all of that time. And I still do some healthcare policy consulting for the governor. And it's actually 25 years that I've been doing legislative work in one way or another. Most of that has been representing, as an advocate, representing nonprofits or state agencies. So not as a lobbyist, but more as an advocate kind of lobbying. And so I'm really excited to talk about advocacy, because that's what I've been doing for a long time. And I have necrotizing myositis diagnosed less than a year ago. Probably had it at least a year before that, before I was diagnosed. But I'm doing really well after I fought the insurance companies for to approve my treatment. And because of the work that I've been doing, I know all of them, and I had to I could call the CEO and I could fight for myself, and I knew how the insurance company worked, and I knew the process, and it still took me multiple appeals before I could get my IVIG approved. So I drafted some legislation, got some legislators to introduce, and the governor to endorse legislation this year for to restrict prior auth and step therapy for persons with autoimmune and rare diseases. Actually, last year, the legislature passed that restriction for autoimmune, cancer, and substance abuse disorders. But it was worded so vaguely that the carriers were still interpreting it to mean that it had to be an FDA-approved drug specific for the disease before they would forego prior authorization. And as you all know, when you have a rare disease, that doesn't necessarily help, because or even the autoimmune disease, because it's if you don't have enough volume of people to do clinical trials and peer-reviewed literature, it will never be FDA approved. And so it leaves a lot of us out in the cold. And so this year I've clarified the language that it could also be off-label use under certain circumstances, and that it also included rare diseases, not just the autoimmune, cancer, and substance disorders. So I'm really hopeful that we'll get that through, and that'll make a big difference. the state legislature doesn't have control over Medicare or self-insured plans, but this would include state employees, retirees, Medicaid, private insurance, individual and group that's not self-insured. It will apply across the board to all of those entities. So, and I'm not aware that anyone else has done that. I know the National Association for Rare Disorders is focused on step therapy, but I don't know that anyone's tackled prior auth.
I don't think so either. I think you're trailblazing in New Mexico, and we are following very closely your efforts and looking forward to the day you let us know you are successful, so we can take that piece and offer it to the 49 other states. And you know, that's one of the reasons why Proclamation 50 is important for us, right? Because we're building a grass tops network of advocates across the entire country. So hopefully we can scale when you succeed, Debbie, not if, but when.
Well, I have the governor behind me, so that'll help.
The support is very
so,
helpful.
Yeah.
Well, speaking of that, Debbie, I mean, you have such an amazingly diverse background, and you know, as Paula stated, you're truly trailblazing in so many ways when it comes to advocacy. What is probably, thinking about your whole career, what is probably your what are you most proud of as far as your advocacy work?
So thanks for the question. I've done a lot of healthcare stuff, a lot of health insurance stuff, a lot around women's health and access for women. But I'm most proud of the End of Life Options Act, and it was that is medical aid and dying for people who are terminally ill, and there are 10 states and DC where that is currently legal, including New Mexico now. And I think I pushed the envelope somewhat on the legislation. I didn't follow the model that had long been established in Oregon and Washington, because I thought it had too many barriers to access. And so we loosened up in some ways but safely in New Mexico. And I think we are now the model legislation and probably the most accessible in the country. And I'm really, really proud of that. And so I've continued to stay really engaged with that effort of implementing that, recruiting and expanding the network of providers, educating individuals, and we formed a nonprofit of the core group of people who advocated getting that legislation passed. We established a nonprofit, and we're the kind of the go-to place for education and support. We have volunteers who will work with individuals up to and including being at the bedside, if that's desired. And we're doing, it's pretty successful. I'm really, really proud of that.
As you should be. That's, you know, difficult decisions, but part of anyone's medical journey, you know, that's admirable work. So thank you for really taking that under your wing and bringing that to life, actually in multiple states. So that's great to hear. So I think we're going to transition into a poll question real quick to engage our audience. So go ahead, Paula, you want to share out that first one?
Yep, sure. So the question should pop up for you on your screen, and the question is about you and the most challenging part of your experience with myositis. And you can select one of the options there, or if you select other, just put into the chat box what you'd like to put on our radar. Your feedback can help us design new and better ways for TMA to fulfill the awareness and advocacy piece of our mission. So the options here are how long it took to be diagnosed, living with a rare disease and explaining it to others, your physical limitations, finding doctors who understand myositis, or other. And we have whole answers coming in fast and furious. We'll give it maybe 30 more seconds because I can tell some people are answering, and then it's anonymous, by the way, and we will share the answers back to you. Thanks, Shauna, for answering in the chat. That works too. Joe, I put the URL for the nonprofit that Debbie was discussing right above in the chat message. It's called End of Life Options New Mexico.
Awesome. Thank you.
Okay, so let's
Okay.
show everybody the poll results, Rachel. Hopefully everybody sees the results here. 40% of our attendees today feel that the most challenging part of their myositis journey is living with a rare disease and explaining it to others. And wow, I mean, I'm so glad you're all here today, because part of advocacy, one of the most foundational parts, is telling your story and bridging from your story to others, right, Debbie? And kind of making a compelling
Yes.
sort of case for legislators, regulators, or others to react to bring about the change you want. Do you
Absolutely.
want to storytelling?
Yeah, I think the strongest and most effective advocacy are personal stories. They're extremely important. Legislators are very attuned to what their constituents are experiencing. And the most powerful testimony we ever get on any legislation is when it's impacting someone personally and they can tell their story.
Well, and we'll also, to piggyback on that one, Paula, too, I think we're probably on the same wavelength here. We have a great opportunity later this month, so we'll drop it in the chat if you'd like to learn from Lindsay Gonzalez, 60 Seconds to Impact and Sharing Your Story with Purpose. So, sometimes it's hard to be clear and concise with our message, so this will be a great opportunity to make that happen. So we'll drop that in the chat for you on the 20th.
Thank you so much. We have a couple more poll questions for you guys, and we have a couple questions starting to come in for Debbie. So we'll give you the next question, Debbie, from the chat.
Okay.
Nancy asks, how will the possible SSI and SSDI funding cuts or changes affect your goals for what you're trying to achieve in New Mexico?
Well, the SSI and SSDI, if those cuts go through, that may just be a lot of talk. I don't know that they will, but if they do, it certainly impacts anyone with a disability, including people with myositis. It won't have any direct impact on the legislation that I'm doing, and if you're on SSDI, on SSI, and you have Medicare, because you've been disabled for a couple of years, Medicare is entirely a federal program. And so the state has zero impact on what the policies are and coverage decisions are under Medicare. So that's where we need federal advocacy, is on Medicare in particular.
And I can share with you, Debbie, and with our meet and greet attendees today, TMA has been actively in discussion with some of the federal regulators for SSI and SSDI. There's something called the Blue Book. There's also a list of diseases that receive compassionate allowances or expedited approvals onto these disability programs. And we would very much like to see all of the subforms of myositis considered as appropriate for those various classifications. If you will.
That would be excellent. I have a daughter with cancer. She's in her 40s now, but she has had cancer since she was a teenager, and it's quite extensive. And so she was on SSI, DI for a while, and we had that expedited decision because of the cancer diagnosis, and that makes all the difference in the world if you have a diagnosis that will do that. Otherwise, it's usually years of fighting to get approval for a disability.
Right. And I know, unfortunately, each of you is shouldering that burden of self-advocacy too, in addition to trying to bring about change in the healthcare system to benefit others. You're still, day by day, depending on what you're going through, having to slog through the insurance approvals or these other regulatory
right.
Do you have any tips, Debbie, for how everybody can be better self-advocates for their own care or for their family members' care, bridging on your daughter's experience?
Well, I think one of the things that I've learned, that, I mean, the insurance industry can be really hard to deal with. I think that they count on people not appealing denials.
Yeah.
They do a lot of denials,
Mhm.
but very few people appeal. And I know it's hard because you're sick, it's tough, that's emotional, but do not take a denial as a final decision. They are counting on you to do that. You must go through the denial process. And I know in New Mexico, if not in, I would assume in other states as well, that once you've exhausted the appeal process with the insurance company, and there are several layers. So there's multiple layers of appeal, and you can ask for expedited appeals, you can ask for peer review, you can ask for, a medical consultation. Then you can appeal it to your Department of Insurance, your superintendent of insurance, or whatever that's called in your state, to make sure that they complied with everything that they needed to comply with. And I know it's hard, but like I say, do not take a denial as the decision. Take it, keep going with it.
Thank you for that encouragement and for those tips. I do think we see many healthcare providers across the country to getting to a point where perhaps they have more staff devoted to prior authorization or PA appeals, and
Right.
they're trying to be more helpful to you as well, even if it may not always feel like that. And if it doesn't feel like that at all, I know doctor shopping is hard. We did see some folks saying that was a very difficult part of their journey right now in the earlier poll question. But that is, don't stop, don't settle, I guess I would say.
Yeah, I agree. If you have a doctor that's not willing to help you, because the insurance company is going to depend on information from your doctor. And so if you don't have one who's willing to fight for you, and I know it's a burden on them, it's a huge burden on them, but if they're not willing to fight for you, you may need to find somebody else who is. Because you can't do it alone. And like I say, just don't give up. They're counting on you to give up. And ask your insurance company for a case manager or for a patient advocate who may help you through the system and help with that a little bit. I don't, because I know when it took me the length of time and how many appeals it took me, and I know everyone and I know how it works. I just really am afraid for everyone else who doesn't have any idea, and can get really easily discouraged and not do it.
Well said, Debbie. Thank you. And thanks to everybody for sharing these great tips in the chat too about experiences with your state senators and congresspeople and disability lawyers. All really good. I sense an updated TMA blog coming on this topic, and we may be emailing several of you to follow up on your comments in the chat.
That's a great idea.
Well, what do you think about another poll question, Laurie?
I think it's about that time. Let's do it.
In unison even. Okay, so Debbie already mentioned NORD in part of her opening remarks, and we are keenly attuned to some of the work that they're doing. Many of you likely heard the Orphan Drug Act was reintroduced this week, bipartisan legislation, and we're very active in supporting our fellow members of NORD. But these other rare advocacy organizations TMA also belongs to, and we're interested in knowing if there's one that you're more active in as an individual, or one that feels more important to you and your family, or one where you would like to see TMA lead more visibly. I'd love to see members of the myositis community getting onto those boards, huh? Laurie and Debbie both chair boards in their volunteer jobs, and I think it'd be great if we could get some board representation on these advocacy groups and coalitions.
Absolutely. That's some of our board members' goals this year, to continue with that outreach. And it just helps, us to understand, the landscape of what's going on out there so that we could best support our myositis community. So we definitely want to hear from you on this one.
Well, it looks like the Rare Disease Diversity Coalition is rating pretty highly among our attendees, as is the Rare Disease Legislative Advocates group. So, Rachel, I think everyone has voted. Maybe 10 more seconds, and then if you could end and share the poll results, that would be great. And this is a great juncture for us to buzz up Rare Disease Week and Rare Disease Day, which probably a lot of you have that on the mind, especially those of you who picked RDLA and are participating in the Every Life Foundation for Rare Diseases advocacy opportunities later this month. Again, February, best month, just truly a star in the calendar. Rachel, would you like to share any highlights of TMA's Rare Disease Week and Rare Disease Day activity?
Well, we are very excited. We collaborate with Every Life Foundation in a way that is just wonderful, because Every Life has the training for you. When you register for them, they will not only set up training for you to help with your ask, but they also schedule your meetings with your representatives, and they provide you materials to actually give them in your meetings. And that happens Rare Disease Week. And although a lot of our members cannot travel to be on Capitol Hill, and join in person in this fight. And so we encourage everyone to check in for Rare Across America, which happens in August. And, 95% of those meetings are virtual. So anyone can attend across the United States, and you can find more information there. Rare Disease Week is February 24th through the 28th. Another activity that we have, I mentioned earlier, is the National Institutes of Health, and we will be at their Bethesda location. They are observing Rare Disease Day and Week with several speakers, one of which is one of our TMA members, Lindsay Gunsel. Will be sharing her patient story on Friday, and she is a new TMA group leader for us, who is getting involved in a little bit of everything, but also reactivating the TMA Minnesota support group. So we're excited to have that on board. And if there's anyone that's close to the Bethesda location, we would love to have them on site and participate in the tour and lunch with us. And if you're a hugger, you'll get a hug, because I'm a hugger. So.
Thank you, Rachel.
If I can add, I strongly encourage everyone to know and meet with their state representative and state senator in your state legislature. Most legislatures are only part of the year. Not all of them are full year. Most are not, but they meet with constituents all the time. And I really strongly encourage you to do that. So they know who you are. You have a chance to tell your story, maybe not in front of a big group, but to individuals, and stay in touch with them, and as well as your congressman or congresswoman and your state senators. They're all home in August if you want to meet with them in person. They all have district offices and district directors who would meet with you, that are there all the time. They are home very often throughout the year, but all of August they're home. And so I would really strongly encourage you. I can tell you, as a district director for a congresswoman and as a state legislator, I spoke with and met with, had coffee with, constituents or in my office all the time. And I really, really strongly encourage you to do that, because as we talked about, like the insurance issues, those are state. Other than Medicare, most, and broadly the ACA of what has to be required and so forth, it's your state that regulates your insurance, and it's your state that regulates your Medicaid. And so you can have a great impact in the state, but you need your congressional members and senators to also know on a national level, and they need to know that they have a constituent. And as those issues come up, that you can call into their office and remind them who you are, or stop by and see their district director or their health policy person. And so I would really strongly encourage people to do that.
So Debbie, to piggyback on that, we have a lot of questions coming in. Essentially, like what would be the best way to approach your state and federal legislators? Like, what would you say to them? Do you have maybe a top 3 talking points that you would encourage members to reach out to their legislators about?
You know, it doesn't have to be anything super specific or super targeted. You're a constituent, you have a rare disease, you would love to talk to them about it and tell them your story. In the state legislature, at least in New Mexico, you can, when the session's on, you can just stop by the office and ask to speak to us. During the year, I get people, they call me or email me because that contact information is available, and ask to meet with me. And that's fine. It doesn't have to be, you don't have to have a super agenda. We're citizen legislators. Most state legislators don't get paid very much. In New Mexico, we don't get paid anything. There are a few that have, salaries and maybe they're all year round, but they also have, all of them have assistants and who can do an initial conversation as well. And the same with the congressional office. You can, if you're in Washington, you just stop by the district office. You could just stop by and say you would love to speak to someone and tell them your story. It doesn't. I'm telling you, people do it all the time. Lots of constituents. So it's nothing special to stop and say you'd love to talk to them.
Debbie, I love how you are promoting, basically cultivating a relationship between yourself and them that can go year round. And someone asked about materials and booklets and if leaving those are effective. And if you think so, then
if you have them, yes, but you don't have to. I think the most important thing is to make an impression on them about you personally, and they're your representative. And you want to tell them your story and the things that you care about, and watch and get on their, get on their email list or have your, their contact information and say, how do I stay in touch with you? And I think that's the most important thing.
I just recently did that with one of our local representatives. Picked a great coffee spot that's in the area, a local spot, and said, hey, want to go grab a cup of coffee? It's a win-win for both, right?
Yeah, I had a favorite coffee shop. That was my office. I met with people all the time, and so I served them, and your Congress people, your state senator, your local senator and representative, they serve you. You elected them, and they don't have to be your party. They serve all of you. And constituent work, and even calling them when you have trouble. So there are every office, probably, certainly the congressional and U.S. Senate offices have staff that work on nothing but constituent issues. And people call in all the time and say, I'm having trouble with this. I can't get movement on that. I can't access that. And it makes a big difference, even if they don't have jurisdiction. If the insurance company gets a letter from the congressman about, can you tell me why, what's going on with this? And they've got people calling, have you resolved this yet? They get noticed and may get some attention. And for the Congress and U.S. Senate, they have contact information on and have an in every state department, state agency. They have their contacts that work with congressional issues. And I can tell you, we had a staff of multiple people, every office does, that does nothing but constituent work. Your governor also will have an office that does constituent work. And that's another one. Our governor meets with people. I don't know, in other states, it may be a little harder to get to your governor, but they'll have a health policy person. And they'll have constituent staff that do constituent issues. So it's just fine. Call the governor's office and say, I'm having trouble with this. I really need some help. And you would not be unusual to do that. That's why they've got the staff to do that, because people call all the time and for a wide variety of stuff. And so make use of them.
Debbie, I almost want to suggest that we sort of sketch this out, because I see in the chat that some folks, want to have a little bit more detail about like what to say or, how to start. So how about Laurie will be the constituent and you'll be the representative, and we'll have a very quick 30-second interaction here.
Okay.
All right. Hey there, Debbie. I am a patient in your area and I have a rare disease, and I really would like to help. I'd really like you to help elevate my voice and my story so that we could help everyone with rare diseases, specifically myositis, throughout my state. So how can we collaborate and connect better?
Well, thank you, Laurie, very much for reaching out. I'd love to hear more about your story and what the issues are. We can talk by phone or Zoom or have coffee if you're able to get out, or come by my office. What works best for you?
Let's meet for some coffee. That would be perfect.
That would be great. Just tell me where you live and what's convenient for you, and a time, and let's figure out a time. I would love to hear more about what's going on with you and how I can be helpful.
Thank you. I look forward to sharing about myositis with you.
Yeah, thank you. It really can be that simple. I can't promise that everybody's going to be as responsive to you as I am, but they should be. I have people come to me say, I want a bill about this. Well, let's talk about that. What's going on? How can we help? And what can we figure out? I mean, I did it all. I cannot stress enough. This is what we do. It's not just when you're in the legislature writing and passing a bill. Constituent work is what we do. And if we didn't have needs and issues that rise up from our constituents, we wouldn't have anything to do. So it does not have to be feel formal, and you should not feel hesitant to reach out and just say, I have a rare disease. I don't know. I don't know what you can do to help me necessarily, or I do. I want to raise my voice. I don't know what there is, or I'm having issues. I don't know whether you can help me. Anything like that is fine.
Thank you so much. And speaking of issues and positions, Debbie, you've given us the perfect segue into our next poll question, which pulls from the public policy priorities of NORD. And by the way, did you know that one thing NORD is working to achieve with TMA and the other rare disease organizations that belong to it is a rare disease advisory council in every state? Last year, we helped get one done in Mississippi. There are several states that are close to enacting an RDAC this legislative cycle at the state level. And so really exciting to consider having 50 RDACs, and that's another avenue of engagement, right? So like Camille has said, if our rep isn't responsive, what should we do? If you are in a state with a rare disease advisory council, that could be another good group of people to reach out to or to connect with.
Yeah, and I have to confess, I don't know whether there's one in New Mexico or not. I'd love to know if there is and connect with them. I know I have talked as a legislator with people with rare diseases. I don't know if they were part of an advisory council or worked with an advisory council, and then they were just they were citizens that had the issue. So I don't know if they were on behalf of the council doing anything, but I would love to know, and I'd love to work on it here if we don't have one.
Well, I'm going to put a link in the chat to the map on the NORD website that has the RDACs, where they are and what movements are afoot to get more established. And
Okay.
in the meantime, we can also all reflect on the question about which of NORD's priorities is most important to you and your family, and how does this feedback help TMA? Well, part of our advocacy goals are more effectively representing you and our community in coalitions like NORD, and it's helpful for us to know which of these 5 policy areas matters most, because that's where we can become more active and join work groups and task forces and send community members for targeted meetings on these issues. So we've got some folks coming in. You know what, I'll put a link to the detailed options or the detailed info rather on these public policy positions from NORD as well in the chat, because as you can imagine, there's like a white paper behind each public policy priority area and specific pieces of legislation at the federal level that relate to each of these. But Debbie, are you surprised that we're seeing so far with the poll results, advancing rare disease research and innovation is the most popular selection here? Is that surprising to you?
No, it's that's more of an up. Well, they're all uphill slogs. I'm not surprised, just because there isn't any, but it's like I said, that it's hard to accomplish if you don't have very many people with the disease. I would assume that people know, or maybe you don't, that the definition of a rare disease is under 200,000 cases in the US. And I don't know on the different myositis what they are. I know on necrotizing it's less than 10,000. The last number I saw from 22, I think, was like 6,000. So diagnostics are getting better. So it's I'm sure more than that, but that's hard to do clinical trials and research, but it would sure help even to have more case studies and literature on what's happening in the field as far as treatment, because when there's not an FDA approved, because of the lack of clinical research, the next place to look for approval of a treatment regimen is what's everyone doing in centers of excellence, and what are those cases look like.
Thank you, Debbie, and thank you everyone for participating in the polls. Again, really helpful feedback, and one of the reasons that Laurie and I wanted to start this meet and greet series is to meet y'all where you are, and we don't know unless you tell us. Not that we usually find that you're very communicative, so thank you for that. I have yet to ask for any feedback or advice or help and not find it in the community, and believe me, we use it. Joe asks how many IBM patients are in the US. Prevalence, questions like that are so important and help to make the case for a number of advocacy issues. We think, maybe 75,000 worldwide have some form of myositis to include IBM. IBM is a little bit better documented in the literature, and Martha may have the numbers offhand.
Yeah, I think, Paula, the best estimate we have for IBM is if we were well diagnosed, there's probably about 20,000 of us. In actuality, there are enough people who are misdiagnosed or undiagnosed that it's probably closer to 15 to 16 at best, or worse, depending on how you look at it. But in terms of the total number.
Thank you. I knew you would have those numbers right on hand. Appreciate you, Martha. And I just want to say, those that might feel small and lonely, just think about the fact that TMA has been organizing and advocating for you and your families since 1993. We have more than 13,000 members and more than 20,000 subscribers on our emails and action alerts. And so together we can be powerful. Well, we have one final poll question for everybody today. So maybe we should organize that, Rachel, while we kind of move towards closing. We just have a few hours left here. And so as we were preparing for today's meet and greet, one question we asked ourselves was, what other resources might you like from TMA? Rich has suggested we work on a one-pager to help equip all of you with the information and talking points you might need when you go to meet with your legislators. There's also some skill building, right? And we can all upskill. Nobody's perfect. So these skills are roughly taken from the National Patient Advocate Foundation Patient Advocacy Curriculum, which is free. And I'm going to put that link in the chat. I've completed this course. I found it very helpful. I know others have as well. So we've got some poll options here. Do you want to talk about the poll options, Laurie, and reflect on any of them in particular?
Sure, absolutely. So we're focusing on things such as like ethics. So how do you balance politics and personal principles? Then also the area of media. So using mass media and social media is not necessarily everyone's strength. So that's an area to level up in. Also narrative medicine. So turning anecdote into evidence. Self-advocacy was the other area, communicating what matters most to you in your care. I think that one hits home, I think, most for me personally. I'm there to be a partner advocate for different people in my life. And I know that it's really important that you're communicating out what matters most to you with your care, with the disease process that you're, going on a journey with. So I think that's a great area to continue to grow our skills in. And then the storytelling. You will hear that a lot from the TMA team this year, because we feel it's important to empower our community with the skills that they need to elevate our patient voice in myositis and rare diseases. We're truly better together, and when we can elevate our voice with that storytelling, that's what matters most. So let's see what is kind of taking the lead here. It looks like storytelling and self-advocacy. They're at the front, and then close follow behind is media. So I think we're on the right track there, Paula, with some of our upcoming programming and offerings, especially with Myositis Awareness Month coming up in May.
Yes, definitely.
Yeah, and again, for legislative advocacy, storytelling is really, really effective.
Well,
I even
Laurie,
know some.
Oh,
Sorry, go ahead, Paula.
I was just going to say we have 1 minute until the top of the hour. So any closing comments from both of you as leaders on today's meet and greet?
Well, I'll just quickly interject here and then pass the mic to Debbie. But even with that storytelling, something, I think what I'm hearing Debbie say is it's really important for you to share out and for your representatives to understand your story and what matters, because it helps them to put a face to a name to a disease process, right? I feel the same way too when it comes to written opportunities. Sometimes if you are giving any sort of letter or information, when you could attach your picture or to it, I think that personalizes it and helps to elevate the human aspect to what you're trying to drive at. So just keep that in mind, when you are communicating out and advocating for yourself. Debbie?
Yeah, I think that's a really good point. I can tell you when we were doing the end of life options, we put together a booklet actually that had very short stories, just a paragraph or so, but a picture. It had a face and it had a short story, and put together a booklet of a few of those, and people they're drawn to it and they want to see what that story is, and they didn't have to be long. And so that's really good. And just one last thing of encouragement. I know it is really hard to tell your personal story to a group of strangers. And it can be very emotional. I try and practice it and do it myself. I talk about my daughter. I talk about my journey with this and that, and it's hard, but it doesn't have to be long to make a super impact. Doesn't, you don't have to tell every detail, but and the emotion, and quite honestly, if you're emotional about it, that gets the legislators having an emotional response. So it's not a bad thing. And so I encourage people to share.
Thank you both
Well-
so much. Laurie Boyer, Chair of the TMA Board of Directors, and Debbie Armstrong, healthcare leader, entrepreneur, attorney, physical therapist, former state representative in the New Mexico Legislature. Just truly a Wonder Woman. We're really grateful for all the ways that you've inspired and encouraged us today. So thanks everyone for being here. We'll post the recording in a couple of weeks on TMA's YouTube channel, and we look forward to seeing you again on an upcoming virtual program.
Thanks,
Thank you, and thank you
everyone.
for having me.
Thank
Appreciate
you.
it, Debbie.
Thank you all.
Bye.
Thank you.
Bye, Rachel.
Thank you, everybody.